This video will guide you through another critical nursing diagnosis: ineffective airway clearance. This is one of the most commonly encountered issues in various patient care settings, so understanding it thoroughly is vital for your nursing practice. Let's get started. Ineffective airway clearance is defined as the inability to clear secretions or obstructions from the respiratory tract to maintain a clear airway. This can lead to compromised oxygenation, ventilation, and ultimately, the patient's health. Defining characteristics. Let's go over some defining characteristics. These are the signs and symptoms that can be observed in patients, which include abnormal breath sounds like wheezing or crackles, ineffective or absent cough, changes in respiratory rate and rhythm, dyspnea or shortness of breath, retained secretions, often seen in suctioning or coughing attempts, cyanosis or a bluish tinge to the skin, indicating inadequate oxygenation, restlessness and anxiety due to difficulty breathing. Related factors. What causes this diagnosis? Here are some related factors to keep in mind. Excessive mucus production, often seen in chronic bronchitis or pneumonia. Environmental secondhand smoke, smoke inhalation, smoking. Airway obstruction from conditions like asthma, foreign objects, or tumors. Neuromuscular dysfunction, as in conditions like stroke or spinal cord injury. Fatigue or weakness, reducing the ability to cough effectively. Pain, especially after surgery, which can limit deep breathing or coughing. Understanding these factors helps you pinpoint interventions and personalize your care. Assessment focus. When assessing a patient with potential airway clearance issues, focus on respiratory rate, rhythm, and effort. Breath sounds using auscultation to detect wheezes, crackles, or diminished sounds. Oxygen saturation levels and arterial blood gases if available. Skin color and perfusion, especially cyanosis. Ability to cough, including strength and effectiveness. Secretions noting color, consistency, and amount. Expected outcomes. Now, let's set our goals. By implementing nursing interventions, we expect the patient to demonstrate effective airway clearance, evident by normal breath sounds and oxygen levels, maintain oxygen saturation per facility or the baseline for the patient, have a normal chest X-ray, breathe deeply and remove secretions, exhibit effective coughing and reduce secretion retention, report improved comfort and ease of breathing, display no signs of cyanosis or hypoxia. Ongoing assessments. Let's break this down into 5 key nursing actions for ongoing assessment and their rationales. Monitor respiratory status. Assess rate, rhythm, depth, and effort of respirations regularly. This detects changes in respiratory status early, allowing timely intervention. Assess breath sounds. Perform auscultation every 2 to 4 hours or as needed. This helps identify areas of consolidation, fluid accumulation, or airway obstruction. Evaluate oxygen saturation. Continuously or intermittently monitor O2 saturation levels. This ensures the patient maintains adequate oxygenation. Observe skin and mucous membranes. Check for cyanosis, pallor, or delayed capillary refill. This identifies hypoxia or poor perfusion early. Monitor patient's ability to cough. Evaluate the strength and effectiveness of the cough. This determines whether secretions can be cleared independently or require assistance. Therapeutic interventions. Now here are 5 therapeutic interventions to support airway clearance, complete with their rationales. Position the patient properly. Encourage high Fowler's or tripod positioning. This maximizes lung expansion and aids in secretion drainage. Administer humidified oxygen. Use humidifiers with oxygen therapy as ordered. This prevents drying of mucosa and loosens secretions for easier clearance. Encourage hydration. Promote fluid intake of 2 to 3 liters per day unless contraindicated. This thins secretions, making them easier to expel. Perform chest physiotherapy. Use techniques like percussion, vibration, or postural drainage. This mobilizes secretions, allowing for more effective coughing or suctioning. Assist with suctioning if needed. Perform oral, nasal, or endotracheal suctioning based on assessment. This clears excessive secretions in patients unable to do so independently. And there you have it, a comprehensive nurse care plan for ineffective airway clearance. By using this structured approach, you can effectively support your patient through recovery while minimizing complications. Well, that ends this video. If you found this video helpful, Don't forget to like, share, and subscribe for more nursing care plans and study tools. Until next time.